What is a periodontal bone grafting? And the periodontal bone grafting, does it really work? And if it does fail, what are my options? Do you want to find out? Stay tuned. Hi, my name is Dr. Kumar Vadivel. I'm a board certified periodontist and a dental specialist. I had the pleasure of seeing this patient today who recently had a bone grafting a few months ago from another periodontist. So this patient was referred to me from her dentist. The other periodontist that she saw, she had a bone grafting done on this bottom left side tooth right here several months ago, and the bone graft did not heal. So the dentist was concerned about the infection she still had, and she had sent that patient to me. So when I looked at her today, and we had a discussion about the failing bone graft she has, and what we mean by failing bone graft is, you can see the bone is coming down here, and then it drops all the way down here on the back of this tooth right here, second tooth from the back, and then bone creeps back up and it's normal. So if you follow from the front to the back, the bone is here, and then when it comes to the back of this second tooth, drops all the way down, goes up, and she got a lot of infection. So unfortunately, the bone graft that she had did not work, that she had about several months ago. What we mean by bone graft is anytime patients have periodontal disease or gum disease, they have advanced bone loss, and the advanced bone loss causes bone destruction, and patients have what we call it as pocketing, and they have really deep pockets, and the deep pocket happens because the bone goes all the way down. As you saw on that other patient, on the x-ray of that other patient, the bone is all the way down. That is what causes the deep pocketing that I showed you on the other picture. So when that happened to this patient had what we call it as a periodontal regenerative procedure, where we try to regenerate the gum and the bone she lost from the periodontal disease or gum disease. However, not always we can guarantee that the bone regenerative procedure is going to work, and that's one of the reasons why this bone graft failed on this patient. So the patient is back in my chair today from her dentist, and the dentist has asked her, talked to her about evaluating the tooth, and what we discussed was not reattempting to do the bone grafting, instead remove the tooth and replace the tooth with a dental implant later. So what we discussed was remove the tooth and do what we call it as another type of bone grafting, what we call it as a ridge preservation. So what I recommended to this patient was to completely remove the infected tooth and do what we call it as a bone grafting here to completely heal the infection. So what that would involve is, on this patient, I will completely remove the tooth and clean out all the infection by scooping out and cleaning out all the infection. When the bone completely heals, then we will go back and replace this tooth with what we call it as a dental implant. So next time at your dentist, or you went to a periodontist, and if you have a failing bone graft and you need help with evaluation of the area, whether the bone graft is healing properly, or you have a failing bone graft, you want to have the tooth replaced, talk to your dentist and they can help you. Or if you happen to be in the Dallas-Fort Worth area, come see us at ToothHQ. We can help you. Until next time, take care.